Hi, happy day off, happy Valentine's Day. Today we're talking about job love. That's one thing you can love too, and I love my job as a NICU nurse and a NICU nurse educator. So I wanted to kind of go over some of the things that were asked this week, and that is how do I get into the NICU, or if I'm interested in the NICU, what are tips for interviewing? So let's review that. First of all, what do you need to do to get into the NICU? So I interview, a couple people a week, depends on the week what we're doing, but done a lot of interviews. So before we even get to the interview stage, what we are looking for in candidates are people who have hospital experience. That's being a tech on any kind of floor. It does not have to be in the NICU. It does not have to be on pediatrics, because being a tech is teaching you hospital experience. It's teaching you time management, getting along with others, reading orders, using the electronic health record, interpreting blood sugars. A tech is going to be huge. So do you have tech experience? And what was that tech experience like is the first thing that we're looking for. The next thing we're looking for, or people ask all the time, is do I, need to have my bachelor's before I get into the NICU, or have experience in adults first? And the answer to both of those is no. We take associate nurses. Many facilities will pay for you to get your bachelor's. So if you are someone that cannot go to a four-year school or cannot get their bachelor's right away, do not let that deter you, from being a nurse or from being a NICU nurse. Just do well and get your nursing degree and get your hospital experience. That is going to be key. So the third thing is being a good fit for the facility. Are you compassionate, outgoing, resilient, positive? Those are the kinds of things we're looking for. Sometimes those things come out in HR interviews before you get to us. So just doing those things and kind of looking for that is going to be key. So those are the three things that we kind of look for before we even bring you in the door. Let's talk about the interview. So in the whole post I put up today is about interview tips specifically for NICU. So let's talk about new grads first. The number one thing we are looking for is, are you passionate for the NICU population? Okay, that's it. If you come in and you say, oh, I love peds, I love kids, I love playing with kids, that doesn't tell us that you are passionate for NICU. If you say, I just love holding babies all day, that's why I'm interested in the NICU, probably not your best answer. It's about the NICU. And remember, the NICU is about two patients. It's the baby and the family. So coming in and talking about you love family-centered care, you've always been drawn to vulnerable patient populations, that being in the NICU and watching babies grow and get bigger and go home has always been so exciting for you, and you love high acuity environments. That's what we're looking for in the NICU. Again, there's a lot more in the post today. You can save it. It's great. It's down there. But the other really big thing is to come prepared with questions, because at the end of the interview, the person's always going to say, do you have any questions for us? Remember, the unit-specific interviewers are not going to be able to answer questions about pay and sign-on bonuses and all of that. That is not our area of expertise. That is HR's job. So you want to ask us specific things about the role, the NICU nurse role, the leadership team, things like that. I love when people are like, why'd you pick the NICU? What's your favorite thing about the NICU? What kind of patients do you like to take care of? That is going to be huge in this environment. So pull out a little notebook. When someone pulls out a notebook, I'm always like, they thought about this interview before they got here. Huge, huge bonus. If you are an experienced NICU nurse and you are looking to change facilities, whether you're moving, I had to do that. Remember, I used to live in Seattle, so I interviewed multiple places here before taking my current job. So if you're an experienced nurse, be able to speak to kind of the patients you took care of and the roles you did at the hospital you worked at. For example, where I worked before, we went to deliveries as bedside nurses. We don't do that as much here at the job I have now. So I was able to speak to my NRP skills when I talked about going to deliveries. I was able to speak about the committees I was on and projects I had implemented. I was able to speak to the different kind of ventilators we used. So that is letting the person that's interviewing you know, hey, this is what her experience like, and it kind of looks like ours, so it is going to match up well. So those are good things to be prepared for. Whether you are an experienced nurse or a brand new nurse out of nursing school interviewing in the NICU, Some things to think of are having just situations ready to go to talk about. So tell me what teamwork's like. When have you seen teamwork be really successful? Then you can say things like, oh, the baby was, having a prolonged apnea and bradycardia. It was time for intubation. The things I saw good with teamwork were role identification and communication. Great answer for an experienced NICU nurse, because then you're saying words that shows that you know the population, apnea, bradycardia, and intubation. If you are just finishing nursing school, you can talk about something that happened in clinical, something that happened at your tech job, or, it could be anything from we had to admit 3 patients, and so we had to divide and conquer, and so it was delegating tasks out. Great example of teamwork. And my final recommendation is to be positive. You want to be positive in an interview. Anytime we kind of hear the negative or oh, my job's so hard, or, it's okay to say I took a job and it didn't feel like a great fit, so I'm looking for something else. But even saying oh, it didn't fit my schedule, or I didn't like working weekends and holidays, again, that doesn't feel great to us. Or I had a terrible manager and I was getting in trouble all the time, or it was really hard for me to get there. I was late a lot. Those kinds of things just don't sound great. So just being positive with your responses, talking about, how much you really enjoyed working there, but you are ready for something new or something more challenging. Maybe you're interviewing for a level 4 from a level 2. You could say I've had the great experience. I've really built my foundation, and now I'm ready for something new and exciting, and I'm excited to learn more. Make it positive.